All right, continue on in chapter 49. We're going to talk about some IV complications. So let's first talk about phlebitis. So if your patient at their IV site has erythema, which is redness, pain, warmth, edema, which is swelling, and indurated or cord-like veins, so meaning it's hard right there where the vein is, or if you see a red streak, those are signs of phlebitis. So in terms of the nursing care, you want to discontinue the IV, so you want to remove it. You want to elevate the extremity, apply warm compresses, and then if ordered, you would obtain a specimen for a culture from the site. Infiltration is the next one I would definitely know in terms of an IV complication. So symptoms of infiltration include swelling around the site, edema, coolness, dampness, and a slowed rate of infusion. So I once had infiltration when I had IV therapy back when I was pregnant. My arm ended up huge. So if the arm looks really big and it's kind of cool to the touch and it's swollen, then chances are that IV has infiltrated. If that happens, you want to discontinue the IV again, elevate the arm, and use warm or cold compresses, depending on what's effective. For a catheter embolus, that means a piece of the catheter has broken loose and it is in the vein. And it's dangerous because it can work up and go to the lungs and cause issues with breathing. It's dangerous. So symptoms include a missing catheter tip when removing the IV, because again, in our last video, we talked about when you remove it, you definitely want to check the tip, and severe pain with migration. So if that catheter tip is kind of moving up, that patient will likely have a lot of pain. So if you suspect a catheter embolism, you want to place a tourniquet high on the extremity and prepare the patient for removal of the tip using x-ray or surgery. So definitely going to want to notify the provider, apply that tourniquet, and they're going to have some immediate intervention to get that out. Okay, let's now talk about fluid overload. So symptoms of fluid overload when a patient's getting IV therapy include increased blood pressure, jugular venous distension, tachycardia, shortness of breath, and crackles when you listen to their lungs, as well as edema. So patients who have like heart failure are at high risk for fluid overload. So if that infusion's going in too fast, it can just back up and then it makes it hard for them to breathe. They end up with edema. It can be really uncomfortable and dangerous. So if your patient is having fluid overload, you want to stop the infusion, raise the head of the bed, monitor their O2 status, and decrease the infusion rate and administer diuretics as ordered. So you're going to want to notify the provider, get that infusion rate lowered, and then they'll likely get diuretics too to get some of that excess fluid off. Cellulitis is another side effect that's rare but can happen with IV therapy. So symptoms include pain, warmth, edema, induration, which is hardness, a red streak, which sounds a little like phlebitis, right? But here's the difference. The patient will likely also have fever, chills, and malaise. So some of those kind of flu-like symptoms or symptoms of infection. So you're going to get some of the local symptoms that are similar to phlebitis, but you're also going to get some systemic symptoms as well. So if your patient has cellulitis as a result of IV therapy, you're going to want to stop the infusion, remove the IV, elevate the extremity, use warm compresses, and obtain a specimen for culture as ordered. And then you're going to want to administer antibiotics, analgesics, and antipyretics as ordered by the physician. So that is cellulitis. So now we're going to move on to chapter 50, where I'm just going to go over a few things. So chapter 50 basically gives a preview to some pharmacology information that will be important for you to know. I don't necessarily know that you will get tested on this information in fundamentals, but it is important for you to know for nursing school and definitely for pharmacology. So one thing covered in here are some possible adverse effects of medications. So some medications have what's called extrapyramidal symptoms. So these include things like dystonia, Parkinson's symptoms, which is like shuffling gait, tremors, that type of thing. Um, Akathisia, which is like motor restlessness, like you can't sit still. And then tardive dyskinesia. So when you're talking about extrapyramidal side effects, it kind of includes all of those things that I just described. Many medications have anticholinergic side effects. So these include urinary retention, constipation, dry mouth, blurry vision, photophobia, and tachycardia. So it basically like drying everything up. So the mnemonic that my teacher taught me, which has stuck with me years later, is can't see, can't pee, can't spit, and can't poop. So, except for it's not poop. So I've never forgotten anticholinergic side effects since then. So if your patient's on a medication that has anticholinergic side effects, you want to teach them to increase their fiber and fluid intake, and wear sunglasses outside. So that'll help protect their eyes from the photophobia, and then the increased fiber and fluid intake will help to counteract the constipation and dryness. And then other medications have something called orthostatic hypotension, meaning that when the patient sits up or stands up, their blood pressure drops and they're at high risk for like passing out or falling. So symptoms of orthostatic hypotension is lightheadedness or dizziness when standing up due to decreased blood pressure. So patient teaching is that they should change positions slowly. So you always want your patient to kind of sit on the side of the bed and kind of hang out there for a minute or two until their blood pressure adjusts, and then slowly get up. And then bleeding is a side effect for several medications. So this may manifest into coffee ground emesis, meaning they've got blood in their emesis or their vomit. It'll kind of look like coffee grounds. Tarry stools, which indicates blood in the stool. Bruising, petechiae, bleeding gums, and oozing blood from the IV site. So these are some things to look out for if the medication you're giving them has a side effect of bleeding. And then the other thing I want to go over in this chapter are foods that affect medication, several medications. So grapefruit juice is a big one. So grapefruit juice affects the metabolism of many medications, including statins. So when in doubt, like if you're given a question on ATI or NCLEX about a food interaction and grapefruit juice is an option, I would go for that because more times than not, that'll be the right answer. Foods high in vitamin K interfere with the effectiveness of warfarin or Coumadin. High protein foods interfere with the absorption of levodopa, which is a Parkinson's medication. Tyramine-rich foods, which include things like smoked meat, cheese, avocado, wine, chocolate, peanuts, bananas, really all the yummy food, right? Chocolate, wine, avocado. Anyway, those are all rich in tyramine, and they can cause a hypertensive crisis in patients who are taking MAOIs. So that's a really important one to know. And then potassium-rich foods, and you probably know these, like there's a cantaloupe and oranges and dark leafy greens and bananas, that type of thing, can cause potassium levels to be too high in patients who are taking ACE inhibitors or patients who are taking like potassium sparing diuretics. So that's something to keep in mind. And then dairy products interfere with tetracycline, which is an antibiotic. So it's important not to take tetracycline within 2 hours of consuming dairy products. So I'm going to stop here and we will pick it up with the next chapter in my next video. Thanks.